हेलो एवरीवन। तो आइए हम कुछ नर्सिंग के इंपॉर्टेंट एमसीक्यू करते हैं जो सभी स्टाफ नर्स के एग्ज़ाम्स में आने के चांसेस ज़्यादा रहते हैं। जैसे एसजीपीजीआई का जो एग्ज़ाम आने वाला है उसके पॉइंट ऑफ व्यू से ही बहुत इंपॉर्टेंट है। तो पहला क्वेश्चन है, नर्स मोनेट इज़ केयरिंग फॉर अ फीमेल क्लाइंट हु हैज़ सुसाइडल टेंडेंसी व्हेन accompanying the client to the restroom. Nurse Monet should option A give her privacy, B allow her to urinate, C open the window and allow her to get some fresh air, D observe her. So इसका राइट आंसर है D observe her. अगला क्वेश्चन है, a client is experiencing an anxiety attack. The most appropriate nursing intervention should include. इसके ऑप्शन है A ask the client to play with, B turning on the television, C staying with the client and speaking in short sentences, D leaving the client alone. So इसका राइट आंसर है staying with client and speaking in short sentences. नेक्स्ट क्वेश्चन है, a 20-year-old client was diagnosed with dependent personality disorder. Which behavior is not most likely to be evidence of ineffective individual coping? So इसके ऑप्शन है A inability to make choice and decision without advice, B avoiding relationship showing interest in solitary activities, C recurrent self-destructive behavior, D showing interest in solitary activities. So इसका राइट आंसर है A inability to make choice and decision without advice. अगला क्वेश्चन है, नर्स क्लेयर is caring for a client diagnosed with bulimia. The most appropriate initial goal for a client diagnosed with bulimia is A avoid shopping plenty of groceries, B eat only 3 meals a day, C identify an anxiety causing situation, D encourage to avoid food. So इसका राइट आंसर है C identify an anxiety causing situation. अगला क्वेश्चन है, a neuromuscular blocking agent is administered to a client before ECT therapy. The nurse should carefully observe the client for. So इसके ऑप्शन है A seizure, B dizziness, C nausea vomiting, D respiratory difficulties. So इसका राइट आंसर है D respiratory difficulties. नेक्स्ट क्वेश्चन है, a 39-year-old mother with obsessive compulsive disorder OCD has become immobilized by her elaborate hand washing and walking rituals. Nurse Trish recognize that the basis of OCD is often. इसके ऑप्शन है A problem with begin to conscious, B problem with anger and remorse, C feeling of guilt and inadequacy, D feeling of unworthiness and hopelessness. So इसका राइट आंसर है B problem with anger and remorse. नेक्स्ट क्वेश्चन है, which of the following approach would be most appropriate to use with a client suffering from narcissistic personality disorder with discrepancies exist between what the client state and what actually exists. So इसके ऑप्शन है A limit setting, B supportive confrontation, C rationalization, D consistency. So इसका राइट आंसर है B supportive confrontation. नेक्स्ट क्वेश्चन है, which of the following food would be nurse Trish eliminate from the diet of a client in alcohol withdrawal? So इसके ऑप्शन है A रेगुलर कॉफ़ी, B सोडा, C ऑरेंज जूस, D मिल्क. तो इसका राइट आंसर है A रेगुलर कॉफ़ी. नेक्स्ट क्वेश्चन है, व्हेन टीचिंग पेरेंट अबाउट चाइल्डहुड डिप्रेशन नर्स ट्रीना शुड से A. इसके ऑप्शन है A इज शॉर्ट ऑन ड्यूरेशन एंड रिजॉल्व ईजिली, B does not respond to conventional treatment, C it may appear acting or behavior, D look almost identical to adult depression. So इसका राइट आंसर है C it may appear acting or behavior. नेक्स्ट क्वेश्चन है, नर्स पेरी इज अवेयर दैट लैंग्वेज डेवलपमेंट इन ऑटिस्टिक चाइल्ड रिजेंबल A स्कैनिंग स्पीच, B स्पीच लैग, C शटरिंग, D इक्वलेलिया. सो इसका राइट आंसर है ऑप्शन D इक्वलेलिया. Next question है, a 60-year-old female client who live alone tell the nurse at the community health center, I really don't need anyone to talk to. The TV is my best friend. The nurse recognizes that client is using the defense mechanism is known as A sublimation, B displacement, C projection, D denial. So इसका राइट आंसर है D denial. अगला क्वेश्चन है, नर्स बेंजी is communicating with a male client with substance induced persistent dementia. The client cannot remember fact and fills in the gaps with imaginary information. Nurse Benji is aware that this is typical of A. Concretism, B. Confabulation, C. Associative looseness, D. Flight of ideas. So इसका correct answer है option B. Confabulation. Next question है, to further assess a client's suicidal potential, nurse Katrina should be especially alert to the client expression of A. Frustration and fear of death, B. Anger and resentment, C. Anxiety and loneliness, D. Hopelessness and hopelessness. Helplessness and hopelessness. So इसका right answer है D. Helplessness and hopelessness. Next question है option 14. Next question है, a 23-year-old client has been admitted with a diagnosis of schizophrenia, says to the nurse, yes, it's March, is little woman. That is literal, no, you know. These statements illustrate a loosening of association, B. Flight of ideas, C. Echolalia, D. Neologism. So its correct answer है A. Loosening of association. Next question है, nurse Tina is caring for a client with depression who has not responded to antidepressant medication. The nurse anticipates that what treatment procedure may be prescribed. A. Electroconvulsive therapy, B. Psychosurgery, C. Short-term seclusion, D. Neuroleptic medication. So इसका right answer है electroconvulsive therapy. Next question है, Mario is admitted to the emergency room with a drug include anxiety related to over ingestion of prescribed antipsychotic medication. The most important piece of information the nurse is changed should often initially is the A. Name of the nearest relative and their phone number, B. Reason for the suicide attempt, C. Name of ingested medication and the amount ingested, D. Length of time on the med. So इसका right answer है C. Name the ingested medication, the amount ingested. Next question है, which of the following approach would be the most appropriate to use with a client suffering from narcissistic personality disorder when discrepancies exist between what the client state and what actually exists. So इसके ऑप्शन है A. Consistency, B. Supportive confrontation, C. Limit setting, D. Rationalization. So इसका right answer है B. Supportive confrontation. Next question है, a 23-year-old client has been admitted with diagnosis schizophrenia, says to the nurse, yes, it's March little woman. That is literally, you know. This statement illustrates A. Neologism, flight of idea, C. Loosening of association, D. Echolalia. So इसका right answer है C. Loosening of association. So ये स्टाफ नर्स के क्वेश्चन जो मेंटल हेल्थ से रिलेटेड थे, प्लीज़ इन क्वेश्चन को स्टडी कर लीजिएगा क्योंकि ये बहुत इंपॉर्टेंट है एग्ज़ाम पॉइंट ऑफ व्यू से, जो कि ऑप्शन से पूछ लिए जाते हैं। जैसे स्टाफ नर्स का एग्ज़ाम हो गया, आरएमएल का हो गया, तो प्लीज़ आप इसकी तैयारी करते रहिएगा। मिलते हैं नेक्स्ट वीडियो में। थैंक यू।